Hello from wherever part of the world you are, and let me officially welcome you to an in-depth view of the current status here at the Tellewoyan Memorial Hospital. By the way, this is the government of Liberia's biggest referral hospital, situated here in Voinjama City, Lofa County. This hospital, by the way, caters to patients who are not just from Liberia, giving its location geographically. It also caters to patients from neighboring Guinea, patients from Sierra Leone. So people from those areas normally visit this facility as well to be treated. Cases are most often transferred from Foya, Kolahun, Vahun to this facility. So it tells you the kind of services that are being rendered to the community members here. So this exercise is actually intended to look at the current status of the facility. In the midst of the challenges that the facility is faced with, there are also positive things, and that's why we felt it was important to come and have an in-depth look or view, if you may, of both the in and outside of this structure. We will first of all begin with the emergency room. And so because of privacy for the patients, will not be going beyond these curtains, because we have to make sure that we respect their privacy. This emergency room is where, when patients are brought at the facility, they bring them here. This is the very first stop. So if it just requires a shorter stay, it means that patient will be treated right here. But if the nurses or doctors are working and they discovered that that patient needs to be admitted, then of course, based on the case, they will be admitted to the required ward. Our next stop is at the OB ward, right? One major and active ward in fact in this facility, given the records of pregnant women, the deliveries on a daily basis and all of that. So there is, like you'll see, the OB ward here. All other caretakers are in fact, family members are in fact all around here, I'm sure, waiting for patients that they've brought.
Music.
And down for the OB ward, we move to the surgical ward. So when you are, supposed to be admitted, like I said, from the ER, it is a surgical situation. This is the ward you will be admitted on, while the doctors are providing the necessary treatment, for you. Next to the surgical ward, as you can see now, we've entered into the neonatal ward. This is an important segment, if you may, of this facility, because this is where kids who are born, are having reached, the stage, especially of being mature. They will be kept in here and they are looked after. That's why you see all of these equipments here. This is the neonatal ward. You see some of the kids lying there. Some of their mothers are all here. The nurses are also around to ensuring that they provide the necessary care for them. Now let's move to the laboratory, one key area, because when you are in a ER and examination is ongoing, normally they will get specimens from you or samples if you make your urine. Sometimes they request for your stool and all of that, and they will take it to the lab for testing. So this is where they are able to determine as to what is it that is affecting you. So this lab is powered, I'm told, by solar. So there are a good number of batteries that are here to ensuring that you have sufficient electricity for the effectiveness of the lab, because there are several equipments here, very big size equipments that consume in terms of electricity. So they have got some good stuff of solar batteries, including solar plates, to be able to keep the laboratory functional. The fact that we've left the lab, let's now move on to the medical ward. If there's a medical situation, then of course you have to be, admitted on this ward. While the doctors, nurses, the physician assistants, all be able to do their work. And after the medical ward, there is the pediatric ward. In fact, just before you enter the pediatric ward, here is the dental clinic. So this is where you will find people who've got problem with toothache. Normally they are brought in here. Down from this dental ward, straight in front of us there you see the pediatric ward where the little kids are admitted. Thankfully, I'm told only one patient in fact we've got in on this identical ward, but it's meant for the kids. So basically when they are diagnosed or whatever and needs to be admitted, this is where they are, and their parents or caretakers are here with them and all of that. So we get outside now from the main hospital. We want to look at the central pharmacy. So this is the pharmacy for the hospital. As you can see, there are different drugs in here, piled up in here. How they get those drugs also, you see the inscriptions. Some you see Ministry of Health, you see, and there are some other drugs as well, I'm sure, that are coming from partners and all of that based on the partnership they've got. So this is the pharmacy where they've got these drugs, and normally when doctors diagnose a patient and a particular drugs is needed, I'm sure they will do the ordering, and then you have the relevant authorities coming to deliver such requests from the doctors, and they can be able to have those drugs. Right, so just from this central pharmacy, it's important that you also take a look of the power hall. Outside here, these are areas that you've got some generators. I'm told some of the generators are down, they are no longer functioning. You have some of them that are working. Again, you and I know the running of these generators, how expensive it is. Some of these generators are 100 kVA, some are 200 or 150 kVA. So you know how many gallons such generator will need to consume, say, in the daytime. So those are things that I'm sure you want to take into consideration as it relates to some of the challenges that the workers here or the administration here is faced with. from the power hall, it's important that you see the reservoir. Yeah, here is it. This is the reservoir for the facility. And after this reservoir, the next my next stop is at this special unit. By the way, this is where you've got perhaps people who've been diagnosed with TB, people diagnosed with HIV and AIDS. Talking about people who are also have been diagnosed of some mental problem are being attended to. So this is where they will come. You have a counseling section, I'm told, and you also have other rooms in here where precisely based on what your conditions are, you are taken to and look after. So this is one unit, by the way, that you also don't want to overlook. It's very much important. Now the warehouse is here. As you can see in here, there are several materials that are available here, and I'm sure normally they will make requests per departments as it relates to those things they need, and when they do that, of course, those things are made available per the records so that you will have the smooth running of the facility. I see cartoons of tar soap here. You see cartoons of hand gloves here as well, and several other items that are needed for the upkeep of the facility. Okay, now we stay on the outside, and there are annexes that have been constructed at the hospital. New ones, by the way. Some of them are not officially open yet because they are, I'm told, completing some of the works. For instance, this is the maternal waiting home, right, being constructed. As you can see, is a funded program from the European Union through the Spotlight Initiative for Liberia. So they've constructed this structure as a maternal waiting home where the pregnant women will have some time to stay just in case they are, they already visited the facility and are not yet ready to give birth, perhaps. So you have them waiting here, and so that by the time they get in pain, it's not a distance from here to get into the OB and have them safe and have the babies safe as well, so that you can have more safe delivery in the facility. Also, now, right from this center, this maternal waiting center here, as you see, is the record room. Previously, the record room was situated somewhere within the building, but that building or room, of course, was very congested, by the way. So the administration thought it wise to have this as an annex. So this annex now is the new, record rooms. As you can see, there we go. The records are all well positioned in terms of how patients have been over the time visiting the facility. The next structure you see here as an annex is the isolation center. You remember when we had a situation of Ebola, in County, this building, in fact, it wasn't as it is right now. So people were isolated in here. They were observed, they were placed on a monitoring, exercise and all of that. And so that's the isolation center. Finally, on this assessment is the administrative or administration building, if you will, where the offices are situated, including an up-to-date conference hall, so that when partners come to the hospital, by the way, or other meetings are held, maybe board meetings and all of that, you wanted to have them seated, comfortably. So the administration, in its own wisdom, has also thought wise to upgrade this conference hall here at the Tellewoyan Hospital. Again, thanks so ever for watching from wherever you are. In the midst of these challenges, you got to know that the administration here is working tirelessly to ensuring that the facility becomes second to none. And that is why it's important that we look out there for partners who can aid us in the process, because like we said, the government is challenged, right? There are several priority areas, and so we cannot just depend on the government for this one facility, which is Tellewoyan, but partners can aid us in the process. Good sons and daughters of the district, of the county, who are in a diaspora could also be of help to us. I remember one time the Voinjama district citizen came up with, I think, helped to repair the X-ray machine that was here. And it was working for some time, but again, it has gone down. So it's important that we all can collectively support the efforts of the staff that are here, the management team here, to ensuring, like I said, that Tellewoyan Hospital becomes second to none.